Thank you for reviewing our quick refresher on healthcare reform. Healthcare reform does require individuals to have medical coverage or pay a penalty. The penalty in 2015 is the greater of 2% of household income, or $325 per adult and $162.50 for each dependent child. The penalty for not carrying insurance in 2016 is increasing. It will be the greater of 2.5% of household income, or $695 per adult and $347.50 for each dependent child. Part of the Patient Protection Act is limiting out-of-pocket expenses for people on medical plans, and the out-of-pocket maximum cannot exceed $6,850 for an individual or $13,700 for a family. There are some exemptions from the penalty. If you're uninsured for less than 3 months of the year, you would not be assessed a penalty. If the lowest price coverage available to you would cost more than 8% of your household income, you would not receive a penalty. Other reasons you would not receive a penalty would be if you don't have to file a tax return because your income's too low, or if you're a member of the federally recognized tribe and eligible for services through an Indian Health Service provider. If you're a member of a recognized health care sharing ministry, if you're a member of a recognized religious sect with religious objections to insurance, and Social Security and Medicare. If you're incarcerated and not awaiting the disposition of charges against you, or if you're not lawfully present in the United States. In addition to the standard exemptions we just went over, there are also hardship exemptions. Those are listed here for you. But if you were homeless or evicted in the past 6 months or facing eviction, you would not receive the penalty. If you received a shut-off notice from a utility company or recently experienced domestic violence, if you recently experienced a death of a close family member, if you experienced a fire, flood, or other natural or human disaster that caused substantial damage to your property, if you filed bankruptcy in the last 6 months, if you had medical expenses that you couldn't pay in the last 24 months, if you experienced unexpected increases in necessary expenses due to caring for an ill, disabled, or aging family member, if you expect to claim a child as a tax dependent who's been denied coverage of Medicaid and CHIP, and another person is required by court order to give medical support to the child, in this case you do not have to pay the penalty for the child. And as a result of eligibility appeals decisions, you're eligible for enrollment in a qualified health plan through the marketplace, lower costs on your monthly medical premiums, or cost-sharing reductions for a time period when you weren't enrolled in a qualified health plan through the marketplace. Or if you were determined ineligible by Medicaid because your state didn't expand eligibility for Medicaid under the Affordable Care Act. Texas did not expand eligibility for Medicaid. If you have any questions regarding any one of these penalty exemptions, you must contact Health and Human Services. Austin Radiology cannot answer these questions. Higginbotham cannot answer these questions. These must be directed directly to Health and Human Services. Thank you.